Hello friends, in this video I am going to discuss another neurocutaneous syndrome, that is Sturge-Weber syndrome. The first point you have to remember that Sturge-Weber syndrome is not inherited, though it is congenital. It is not inherited. I have already told you that most of the neurocutaneous syndromes show autosomal dominant pattern of inheritance, but Sturge-Weber syndrome is an exception. It is not inherited. It is caused by somatic mosaicism in the gene GNAQ. So this is the gene that is affected in Sturge-Weber syndrome, and it is not inherited. It is otherwise known as encephalotrigeminal angiomatosis. So angiomatosis means there will be capillary vascular malformation, and this capillary vascular malformation will be seen in the trigeminal distribution and inside the brain. Okay, it is seen in the trigeminal distribution and inside the brain. So that's why it is otherwise known as encephalotrigeminal angiomatosis. In the trigeminal distribution, as you all know, trigeminal nerve is giving sensory supply to the face. This is the V1, this is the V2, and this is the V3 area. So trigeminal nerve has 3 branches, and the V1, V2, and V3, these are the 3 branches. In this condition, in Sturge-Weber syndrome, it is the V1 and V2 areas are affected. So these are the V1, V2 area, and these areas are affected in Sturge-Weber syndrome. Okay. So this is otherwise known as nevus primus, or also described as Port-Weinstein. So Port-Weinstein is seen in Sturge-Weber syndrome. Okay, and it is affecting the V1 and V2 area of the trigeminal nerve. In the same side, okay, so if this patient is having this Port-Weinstein on the right side, the same side of the brain, also the patient will have leptomeningeal angiomatosis with calcification. Angiomatosis plus calcification. Okay, and this leptomeningeal angiomatosis and calcification, this will cause epilepsy or seizure and intellectual disability. They can also have this episcleral angiomas, and this episcleral angiomas can actually cause blockage of the aqueous humor flow. It can cause blockade of the aqueous humor flow. So that can actually cause increase in intraocular pressure. Okay, increase in intraocular pressure leading to glaucoma. Okay. So these are all the clinical features of Sturge-Weber syndrome, and you need to remember that it is not inherited. It is caused by somatic mosaicism in GNAQ gene.